Welcome back to WMBC News. Breast cancer is the second leading cause of death among women in this country, which is why October is dedicated to raising awareness about prevention and treatment. Joining me today is Dr. Adrienne Salerno. She's a board-certified physician in family medicine. Dr. Salerno, thank you so much for being here.
Thanks so much for having me.
So what are the risk factors of getting breast cancer?
So there are some risk factors that we don't have any control over. So things like family history, especially those with the BRCA gene, we don't have any control over. Having first-degree relatives with breast cancer definitely increases our risk. Other things like never being pregnant and having our first pregnancy after the age of 35 also increases our risk, and our risk increases as we get older. There are some risk factors that we do have control over, so things like smoking and obesity, in addition to hormone use after menopause. All of those sorts of things we do have control over, but those things also increase our risk.
You mentioned the BRCA gene. Now, if you have that gene, that doesn't necessarily mean you will have breast cancer.
So as it turns out, if you do have a BRCA gene positive, then you do have a 70% chance of getting breast cancer, which is much more increased than the regular population. So as a whole, our population has a 1 in 8 chance of getting breast cancer in their lifetime. But having the BRCA positive gene actually increases your risk to about 70%.
And family history and age are risk factors that we can't control, as you mentioned. What are some measures we can take to prevent breast cancer?
Maintaining a healthy weight. We do know that obesity increases our risk for breast cancer, so getting regular exercise, eating a healthy diet, and maintaining a healthy weight definitely can decrease our risk. Also, avoiding things like smoking and the use of hormones after menopause can definitely increase our risk.
Part of early detection is knowing the symptoms. What are the symptoms of breast cancer?
There are sometimes no symptoms of breast cancer, so it's important to get screened. Some things that would indicate that possibly we could have something going on would be finding a lump in the breast, seeing a change in the shape or the color of the nipple. Sometimes discharge from the nipple could be considered, it could be a problem that we want to get checked out that could be breast cancer as well.
How often should one get mammograms?
There are several groups that give us recommendations or guidelines on this subject. So the American College of Obstetricians and Gynecologists recommends starting at age 40 and getting a mammogram every year to every 2 years until you're 75. The U.S. Preventative Task Force gives us minimum guidelines that say start at age 50 and get a mammogram every 2 years until we're 75. But again, these are discussions to have with your provider. Exactly how often you go and what age you start and what age you stop getting mammograms is really a discussion to have with your provider. Some of those with increased risk will probably want to be screened every year. Someone with a very low risk that finds the mammograms uncomfortable may want to do the every 2 years and not start until age 50.
And you mentioned self-checks. What is the technique and how often should we do it?
Doing a breast exam on yourself at home about once a month is probably the best recommendation that we have. So it's important to know what's normal for you, to know a baseline, so that way if something abnormal comes up, you can discuss that with your provider.
And what's the confirmed diagnosis of a breast cancer?
To confirm the diagnosis, it actually goes much beyond the screening. So the steps usually are we do regular screening. So the regular screening that we recommended first start with a mammogram. If for some reason we find something abnormal on the mammogram, then the next step sometimes is getting an ultrasound, and sometimes it's getting a biopsy. Sometimes we do a preliminary biopsy, which is called a fine needle biopsy, where we take a small sample of the item that was abnormal in the mammogram, and sometimes we do an ultrasound to further evaluate and just watch it to see if it changes over time. Once the biopsy results are in, oftentimes that can tell us if there are abnormal cells or not, and sometimes that leads to further biopsies to confirm the diagnosis, and sometimes that can confirm the diagnosis just from the biopsy itself.
And what are the biggest misconceptions about breast cancer?
There's a few misconceptions about breast cancer. Relating to the biopsies, a lot of times women are very concerned if they have anything abnormal on a mammogram that they have breast cancer. But the truth is most abnormalities on mammograms don't turn out to be breast cancer. It's a very small percentage of the abnormalities that really turn out to be breast cancer. But it's important to get all of those checked and followed on a regular basis.
And men are also prone to getting the breast cancer.
That's right. It turns out women are 100 times more likely to get breast cancer than men, but men can still get breast cancer. So it's important if men saw anything abnormal on exam, if the men noticed any changes in their nipples, if they noticed any lumps or changes in their chest, they should get it checked out with their provider.
And what is the biggest takeaway?
I think the biggest takeaway is to get screened. We have good outcomes for women with early detection and early treatment. So the biggest takeaway is have a discussion with your provider on how often you should be screened and go for your mammograms.
Dr. Salerno, thank you so much for joining us.
Thanks so much for having me.
WMBC News will be right back.